We saw some longer-term follow-up of a number of studies going from the Embrave 150 study, seeing survival extended with atezolizumab and bevacizumab versus sorafenib. This was an interesting study result to see. We also saw the Keynote 177 results showing longer term follow-up and later line therapy. There's still improvement in outcome. So I think confirms the conclusion that many of us previously had, that for patients that are MSI high should be getting immunotherapy right up front for the most part. And there were some other interesting results. For example, the POLO study, which was in pancreas cancer with olaparib, and falling short with the overall survival endpoint, showing some of the other endpoints like PFS2 still being maintained in the olaparib arm. But I think that is an issue in terms of the overall survival not being met and maybe dampening our enthusiasm for some patients or many patients. The other part of that study, of course, was that there wasn't any active maintenance therapy in the control arm, where many of us would be doing that, which would probably mitigate any of these survival advantages further. So that was some important information that came out from the POLO study. Another one from pancreatic cancer, the Alliance study, which was a randomized study for borderline pancreatic cancer, randomizing patients to neoadjuvant modified FOLFIRINOX for 8 cycles versus FOLFIRINOX for 7 cycles, and then a course of chemoradiation. And interestingly, the arm was with the radiation actually was stopped early because it failed the futility analysis endpoints, and so the treatment continued just in the FOLFIRINOX, just 8 cycles, then surgery arm. And in all of the parameters, whether it be R0 resection or overall survival, we're all in favor of actually the chemotherapy arm. So that's, I think, a little surprising to some of us. And so may change some practices in some way based on that result. So that was an important result to see. There were other interesting earlier phase studies that were important to note. One was a drug ZW25, which was looking. It's a novel antibody for bivalent for the trastuzumab and pertuzumab epitopes, and it was being looked at 2 abstracts, one in gastroesophageal cancer late line and one in biliary tract cancer late line, and both of those expansion cohorts from their initial phase 1 studies showing promising outcomes in those patients with response rates that were pretty impressive, 30%, 40% in gastric and biliary cancer respectively. So we'll be probably seeing other studies with that agent at larger scale going forward. And another interesting study, I think, that should be mentioned, it was pembrolizumab and lenvatinib for gastric cancer. That was part of a multi-cohort analysis, of which there are abstracts in a number of tumor types. But the gastric one I point out because we've already seen some data with lenvatinib and pembrolizumab that's already published now in Lancet Oncology, coming out of Japan, and with really extraordinary response rates, like nearly 70% response rate. It was a smaller cohort of only 20 some odd patients, and so that was really promising and really leading to a lot of excitement. I think half of patients were second line and not really heavily pretreated patients, but in this cohort that was reported from GI ASCO, which is more of a global representation of patients, we saw only a 10% response rate in 31 patients. And so that's a pretty big discrepancy in terms of sort of response rate. So, maybe the truth lies somewhere in between, but, and these are very small sample sizes, but it is sort of a huge difference in terms of what one might have seen from that other study to this study. So I think that those would be some of the main highlights that come to mind from the meeting.